Welcome to Medical Myths, Legends, and Fairy Tales. I'm your host, Dr. Alan Christensen. Look, you know that between the latest online fads and the crazy media headlines, it's easier than ever to get confused about your health. And you and I just want to feel better and live longer. We want to know what works. And we can't wait for further studies. We need to make decisions today based on the best evidence we've got. Well, that's exactly what this show is here for. So let's get to it.
Hi there, this is Dr. Linda Kashaba from Integrative Health. Would you like some help with your thyroid? We would absolutely love to help you out. And guess what? We can even do remote care. Please call us today at 480-657-0003 to set up your first appointment. If you mention code podcast20, you will get 20% off from your first visit. That phone number again is 480-657-0003, and the code is podcast20. Can't wait to meet you.
Hey, Dr. C here with you. So today's guest is Dr. Shelena Lalji. She's the founder of Dr. Shell Wellness and Aesthetic Center, which has been in the Houston area for over 20 years. She's an honor graduate from Emory University in Atlanta, Georgia. She's a board-certified OBGYN who's devoted her full-time practice to aesthetics and wellness medicine. But we're speaking about neurodegenerative diseases. Shell's a personal friend. I've known her for quite some time, and a real difficult thing has struck her family. And she talks about that in some very caring, insightful details. And we'll learn a lot about how neurodegenerative diseases can be underdiagnosed, unexpected, but how there can be hope. So a really powerful interview, and hope you guys enjoy this. It was a real touching thing. Dr. Shel Lalji, how you doing?
Hey, great to be here, Dr. Christensen.
Good. Good to have you.
Thank you.
Yeah, we were hanging out not too long ago, and you reached out and said, hey, there's a topic that people are not thinking about.
Right.
And it's a myth by absence that people think that these things are quite rare or that there's not much can be done about them. But you suggest we talk about neurodegenerative diseases.
Yes, very close, near and dear to my heart, Alan, as you know.
I do. And I've known about your story a bit about from when it started. So do you want to just fill us in on why this became a strong topic of interest for you?
Oh, absolutely. You know, I always say that you don't choose your mission chooses you, right? We're all sort of moving along in our lives and doing what we think we're meant to do and we think we're supposed to do, and we're enjoying it and becoming, what we think we want to be. And all of a sudden, God speaks to you in a different way, and He wants something that's totally different than what you had ever thought. And that's sort of what happened to me and my family almost exactly 2 years ago, Dr. C.
I was thinking it was about 2 years. Yeah.
Yeah. It, in a way, time flies, and in a way it goes so very slowly, where you really seriously take 1 hour at a time, not even one day at a time. So, 2 years ago, unfortunately, one of the biggest nightmares that we would have ever even dreamed of or imagined, it sort of started with July 1st. So a little over 2 years ago, we were hiking in Banff, and my husband had a fall while we were hiking and broke his ankle, just minor fracture of his ankle. And we thought, just a minor fracture, we'll do some rehab, put him in a little boot, and off we go, move on with life and do what we normally do. And, we were so blessed and still are so blessed, but we had a really, really good life. We have two beautiful children. They're now 15 and 18, Zoe and Zaid. And he's a dentist of 25 plus years with 9 dental offices. I'm a gynecologist, functional medicine doctor, do wellness and aesthetics. We just felt like we were living the life we were meant to live, serving a lot of people along the way and doing as much as possible for humanity. And then we just came to this massive stop. And what we thought was going to be 6 to 8 weeks of rehab and back to normalcy turned into, when we got into the month of August, we started seeing that he was experiencing a great deal of weakness.
Hmm.
And he's a very fit guy. You've met him before.
Yeah, yeah.
And very fit, very just vivacious, full of life, vibrant guy, very intelligent and entrepreneurial spirit, very giving spirit. And he just was not himself, in August. And I go back to this because it's very pertinent to what we feel caused his diagnosis that he has now, which is Lou Gehrig's disease, also known as ALS or amyotrophic lateral sclerosis. So in August, we started seeing a lot of weakness. He had actually done a major intermittent fasting program and lost 15 pounds. And if you recall, he didn't really have 15 pounds to lose. So
No.
with that loss came a lot of release of what we think, a lot of release of toxins because of such immediate or very short-term, weight loss that happened so quickly. And then the weakness came in, and September 5th, and I'll never forget this date. I was seeing patients. His office and my office are close to each other, right next door, as a matter of fact, in the same building. And he walks into my office and he says, "Shell, I think I have ALS."
Oh, wow.
Yeah, and it came out of the absolute blue. And I looked at him, and I was just in the midst of a couple of patients, and I said, "Honey, come on, there's no way. I know you've been feeling weak, and I know you've been, struggling with figuring out what's going on, and we're both trying to really identify what we've got going on, but there is no way. There is absolutely no way." So he was very convinced because that day he started having fasciculations, which is twitching, muscle twitches, literally all over his body, head to toe.
Hmm.
You could actually visualize his biceps and his triceps and his, calf muscles just twitching away. And I thought, well, that is kind of odd. But, quick search on the internet, there's 12 different benign reasons for, benign fasciculations. Called up my
Sure.
neurologist and I said, "Hey, we need to come in to see you like now during lunch hour." And as a good friend of mine, he said, "Just come on over. I don't want you to be stressing about this." So he came over and he said, "You look fine. You do not have ALS. I can almost guarantee you do not have ALS. You have some form of benign fasciculations. You've been under a lot of stress. Like I mentioned, it's a dentist with 9 some dental offices, lots of employees." And he said, "Just take it easy. You've had this fracture. You've been under stress, rehab. You've lost this weight. All is good. We'll figure this out, but it is not ALS." And I say this, and I like to go into this detail, Alan, because that's how most ALS diagnoses begin.
Really?
Yes, in the sense of, you look at so many, and trust me when I tell you, in the last 2 years, I feel like I've done 3 PhDs, in neurodegenerative diseases and ALS because of the depth of research that my team and I have conducted in this process. And what we've seen is the the predispositions, right? So you see predispositions and people think, "Oh, well, genetics, that has a lot to do with it." Well, in ALS, it only contributes to 5 to 10% of cases.
Hmm.
So the rest of it is epigenetics. The rest of it is environmental, which is kind of scary, right? Which means it can happen to literally anybody. Any of us listening to that podcast, I hope it happens to not one more person in this world, but it can happen to literally anybody. And you and I are doctors, and we've seen illness and diseases, and we've seen terrible things happen to really good people. But I will say this, and this is not just because my family's going through this, but the process that a condition like ALS takes a patient and their family through, I have never in my life seen such devastation because literally every single function is taken away from you. So be it the ability to walk, to talk, to eat, to swallow, to chew, to dress yourself, to do things, your basic necessities for yourself. And finally, it takes away the ability for you to breathe. And that's how most people lose their lives, right? And that process, Alan, takes no more than 2 to 5 years on average. And most people would you believe, take at least 1 to 2 years to even get to diagnosis, which means
Wow.
they're not left with much time after that.
Wow. Your first consult for this, you're told it's not ALS, you're gonna diagnose it further. So the first symptoms were likely that instability of the ankle from July or so. So we're a couple months into the earliest symptoms.
Right. Right. Exactly. So just some instability, some weakness, and you expect some compensation with the weakness. You expect all of that, with just fatigue and things of that nature because it's something that you're dealing with. And then when the fasciculations come, well, there's 12 different things it could be. So it could be anything. But there began our journey of, the prayers and the hope that it is anything but ALS. Because
Hmm.
ALS, as you well know, is something nobody wants to hear, right? Um, and like I was mentioning earlier, a lot of what we have seen, so military personnel, because of trauma, because of emotional trauma, physical trauma, toxins, vaccinations, so on and so forth, and they haven't identified what one thing, but I feel that it is, of course, a constitution of things. Military personnel is twice as likely to develop ALS. Isn't that
Hmm.
interesting?
Yeah.
The athletes are, people who have repetitive injuries and concussions and, injuries to their bones and inflammation, again, almost twice as developing to develop ALS as the normal population.
Well, and help me really quickly here. 'Cause I know it's rarer. I'd love to hear your numbers, more precise numbers, but it's hard when conditions are rare to get good numbers on how they change or what affects them because there's often just so few numbers to deal with.
You're right. You're absolutely right. And the statistic when you read it, which is a gross underestimation, and I will say it's a gross underestimation for a couple of reasons that I will, tell you in a second. The statistics say in the United States, 30,000 people are affected. But yet, we do know, and it's all over the place, every 90 minutes, a new person is diagnosed with ALS. And every 90 minutes, a person loses their battle with ALS.
Hmm.
If you do the math, there's no way. And number two, I'll give you a concrete example. Last week, seeing patients in my office. And as you and I conduct our functional medicine practice, we don't see tons of patients. We see more quality. I spent 45 minutes to an hour with my new patients. So on that particular day, I saw 10 really intense patients. Dr. C, 5 of those patients had a direct relationship to an immediate family relative or a very close friend that had ALS.
Hmm.
50%. So there is no way that this disease only affects 30,000 people. I think by the time they're diagnosed, they're already almost dead.
Is there data about the rates of it changing, or has it been steady since it's been known about? Or
They are conducting studies of to that nature, but once again, just like you said, when the numbers are so low, the interest
yeah,
is low, right? And when the interest is low, it's because the money is low and the funding is low. And so when you actually look at some of the really, in-depth expertise out there, will say over and over again that ALS is not incurable, it is underfunded.
really harsh perspective. I never thought about this before relative to ALS, but the big economic trend that drives so much medicine is what are the pills that a lot of people take for conditions that they'll have for a long period of time. Cholesterol lowering, blood pressure management.
Yeah,
That's the magic formula. The most
yeah,
people taking a lot of pills for a lot of years.
yes.
So for a rare condition with not that long of a duration in many cases between diagnosis and expectancy, yeah, that makes sense. That would be the opposite end of that spectrum.
Correct. Absolutely. And it is a very sad area of the spectrum, as you can imagine, if you are a family that's going through it, right? So
Yeah.
then you end up feeling like it is entirely up to you because, there's just not much being done about it. I mean, ALS came on the map, as you know, by Lou Gehrig in, about 80 years ago this year. Exactly 80 years ago
Hmm.
this year, Lou Gehrig came out and gave his famous speech of how blessed he is. And a couple years later, he was no longer. But that's what put it on the map the first time. The second time it was put on the map by Stephen Hawking, as you know.
Mhm.
And he was very unusual in the sense that he had ALS for over 50 years, but he was only in his 20s when he was diagnosed. And then, of course, the third time was at the Ice Bucket Challenge, which was in 2014. And
Okay.
we all did it. We all did the Ice Bucket Challenge. And I can guarantee you 80 to 90% of people that did the Ice Bucket Challenge knew almost nothing about the condition called
Hmm.
ALS. Myself included. It wasn't something that was on my radar because it's not something I treated as a physician, nor did I know anybody personally who had ALS.
I just saw Stephen Hawking's movie recently, the movie
Uh-huh.
about his life.
Yes.
Powerful story. His books were great. I'd read his books in the past.
Hmm.
His longevity, is that a complete and total outlier? Was his age a factor? I mean, how unusual was that?
So that's a great question. And he was, so to speak, an outlier. But here's what I would say that I believe, well, first of all, Stephen Hawking got traked um, pretty soon into the ball game for him, right? So when I mentioned that the final straw for most ALS patients is losing the ability to breathe,
Hmm.
well, you can get traked and get that ability to breathe. So essentially, most ALS patients who want to live longer than the usual 2 to 5 years, you'll find that they have a feeding tube. You'll find that they have a trach. You'll find that they have, all different elements of the powered chair and all the different things that are required to keep them alive and 24/7 care.
Hmm.
And not everybody can afford that. So right now the statistic is besides Medicare, what Medicare pays and insurance pays, the cost to keep an ALS patient alive is $250,000 out of pocket per year.
Oh my goodness.
And I can vouch for that because, we do have 24/7 care at this point. And yes, it is extremely expensive and it's not everybody's, unfortunately, everybody doesn't have that resource. So that in itself makes the decision to call it quits. So why do
Oh,
people,
that is
yeah,
tragic.
it's very tragic. And so only 10% of patients choose to get a trach. And most of the 90% that choose not to get a trach, it's because of financial reasons.
Oh my goodness.
Yes.
So they know that they could breathe longer if they had that, but they know
Yes.
that the families can't afford it, and that's how this decision is made. Oh
That's
my
right.
goodness.
That's right. And so when you hear something like that, breaks your heart, right? Breaks your heart completely.
Completely.
And unfortunately, there's just not enough money given to taking care of patients with ALS. And I'll tell you, even if you have a patient who's trached, insurance will not cover it. They won't cover the 24/7 care that is required, medically required, and they will not cover it. So that is, of course, a battle that needs to be fought as well. But again, because of the sheer low numbers, the attention is not paid to it. So you
Wow.
have to, and then you have to ask yourself the question, and this is a personal, you know, part that I'll share with you. If you have 24 hours in a day, are you going to spend that time spending quality time with your loved one? Are you going to spend the time trying to research, trying to gather information, trying to work on medical treatments, trying to financially afford, the care, trying to work if you're working, trying to spend time with your kids, trying to make memories, what are you going to do with those 24 hours in a day that you have? And how can you do it all? So most patients don't have the time to go, to Capitol Hill and make a case for themselves or fight these battles. And thus, they have caregiver exhaustion, right? And so at
Yeah.
that point, they really don't, they're just surviving. They're in survival mode like we have been. And so we're blessed once again, always, always, always count our blessings on an everyday basis that IS is still with us because when we, continued our process of getting a diagnosis, we went to a few different neuromuscular specialists and they gave us, nope, he doesn't have ALS. I
Oh,
flew
wow.
him, flew him to a functional medicine neurologist across the country. And we got it's possible, but I really don't believe so. I flew him to Mayo Clinic and we got when we first got there, it was a 5-day process. Isn't that crazy? A 5-day process at
Yeah.
Mayo, doing every single thing that you can ever imagine, imaging every area, spinal tap, all kinds of blood tests, this test, that test, whatever. And when we first got there, they said unlikely, which then changed after 2 days to possibly. And then when we left, it was probably, but not definitive. And
Wow.
this was middle of November. One thing that I would like to mention that was very pertinent at this time is my husband was in a CT scan during this time, and I went and spoke to the entire team of the ALS experts at Mayo, and I said, I need to know some answers to some tough questions because we have kids and we need to just sort of plan what we're looking at. And by that time, Dr. Christensen, he had gone from perfectly normal to not being able to walk without a walker. And I was pushing him around in a wheelchair most of the time when we were at Mayo. He wasn't able to dress himself at that time. And he was still able to speak, but we could sense some very minor slurred speech. And so looking at the rate of progression from complete normal to this in a matter of 2 months, besides the
Wow.
articulations, Mayo Clinic told me we have 6 to 9 months.
Oh my goodness.
Yeah. So this was November of 2017. And how
Wow.
blessed do we feel that we still have him, right?
So the various steps that you went through, was that a matter of the final source being more thorough and more specific, or was it a matter of the disease being more progressed and more apparent by then? How do you think about that distinction?
I think that's a great question, and I think it's a combination. So ALS, as you probably know, but maybe the listeners don't, is a diagnosis of exclusion pretty much.
Yeah.
So you have to exclude every single thing out there. And then one of the diagnostic tests is an EMG, where you do, the electrical muscle stimulation to see what you're seeing on the graph. And so, and you have to have 3 or more positive areas. So at the Mayo Clinic, we had 2 positive areas. And then the end of that month, when we went to Houston Methodist here with a world-renowned guy, Dr. Stanley Appel, we got the final diagnosis at the end of November 2017 because the 3rd area was positive. So I think it was progression, but also the entire process of ruling every single thing out. Because along the way, we thought, and Mayo thought, it could very well be copper deficiency myelopathy. Yeah. And so we went down that track and just hoped and prayed it was, because that's an easy one to treat. We also thought it was, there's a condition where you have cervical myelopathy, where there's, there's impingement onto the cervical nerves and spinal nerves and what have you. So you can lose motor function, but also you lose sensory function. And so he did have a lot of cervical stenosis and things of that nature. So we were kind of going down that track. And would you believe that, the recommendation was made to us along the way to have surgery, neurosurgery, to try to release some of that pressure. And thank God we had the clarity at the time to say we could go through this surgery and it may do nothing except make matters worse. So let's kind of maybe hold off for a couple of weeks and see, what more we can find out. But a lot of patients in the process of diagnoses go through surgeries and go through things that, absolutely make things worse. And it's not anybody's fault. Absolutely not. It's just a very, very, very challenging diagnosis. And it's one that nobody wants to give as a physician because it's almost a death sentence. So you're reading a patient their rights and reading them their death sentence, because even today in neurologic centers all over the world, a lot of neurologists, unfortunately, when they diagnose ALS, they will literally say, there are no treatments, there is no cure. We suggest that you go home and get your affairs in order.
Wow.
So,
is that how things are presented to you with the first clear diagnosis, or how did that come about for you guys?
In a way, yes. In a way, yes.
Yeah.
It was presented to us where, and it was interesting because the neurologist that we were with, he's a great, great guy, and he's become, a good friend, but he also is very traditional minded. And, over time, he has come to the realization, or his thought process is false hope is not good, right? So a lot of traditional doctors, we feel that look at hope as false hope because they've never actually witnessed an ALS reversal. And so him knowing the fact that I was a functional medicine doctor and, I'd already looked at all different root causes, all different potential treatments, all different potential avenues for trial, discouraged me and said, that's what we call VIP medicine, and VIP medicine does not work. And what that means, you and I know what that means. Basically, what that means is you might have the resources to try everything from, gut-brain connection and toxins and, reversing microbes and going through. And I'll go into some of the things that I feel that are the root causes, and perhaps regenerative medicine with stem cells and so on and so forth. But everybody I know, a lot of people I know have tried it. It doesn't work. It just makes matters worse, and you can end up doing harm. So we suggest just try to live life and, live life to the best of your ability.
We'll be right back after a word from Integrative Health.
We hope you are enjoying this episode of Medical Myths, Legends, and Fairy Tales. This is Dr. Turner at Integrative Healthcare. So often we hear from our new patients that their primary care physician has told them that their thyroid and hormone levels are fine, and they should not worry. Yet the patients still have symptoms of severe fatigue, thinning hair, and weight issues. Unfortunately, this is too common with thyroid care. The good news is we can help, and there is hope. The doctors at Integrative Health, including myself, specialize in naturally treating thyroid, hormone, and adrenal issues. We would love to get you started on the path to ideal health. From the comfort of your own home, you can get treatment with one of the doctors at Integrative Health via telemedicine. Go to integrativehealthcare.com to become a new patient today. Use code PODCAST20 for 20% off your new patient visit. Again, that is integrativehealthcare.com and use code PODCAST20. Get back on the road to thriving.
And now, back for more medical myths, legends, and fairy tales. Just to quickly mention a topic that became clear to me in working on the current book. We always have this idea that if we could just find the root cause, and there are many cases, like for example in thyroid disease, we see that it's higher in places that have a more sterile, hygienic environment. A lot of autoimmunity is called the hygiene hypothesis, and it may be a causative factor, but that doesn't mean that it really gives you anything to do. You grew up in a certain way. Well, that came and went.
Correct.
Someone could have a car accident where the root cause was speeding, but that doesn't mean that driving 2 miles an hour will reverse the damage that occurred.
You're right.
So there are times in which finding the root cause is not helpful for treatment, and that there are many times where it is, where there are causative factors that may be perpetuating factors. But we see that finding the root cause is not always what it's cracked up to be.
Isn't that interesting? Because you're absolutely right. It's not always a one-size-fits-all, right? So for certain conditions, root cause might be very helpful, and in others, it will not, because you almost have to look at where are we and where do we go from here.
Does the root cause change the progression, or does it change the outcome, right? To address it or change it now, yeah.
Correct. And in the form of ALS, it's interesting that you bring that up. We do know, and I can say this without a shadow of doubt, there is no one root cause for ALS. I know that 100%. I could put my life on that. There are a variety of root causes that affect this process. And what happens is it depends on who you are, what your background is. Do you have a genetic predisposition? Do you have other elements that are causing this? How much exposure do you have for, towards inflammation, infectious agents, autoimmune, toxins, heavy metals? What was your childhood like? How much emotional and spiritual trauma did you have? What kinds of toxins were you exposed to? What kind of environmental agents are you exposed to? And all of those things are indeed very important and really do cause components of this, right? But it's almost like what was the straw that broke the camel's back, right? So and when I talk about the fracture or an intense stress, an intense moment of stress or an intense type of stress, that can certainly be the straw that broke the camel's back. Does that make sense?
Totally.
So
There's some constellation of things that are present, and then something precipitates, something pushes it over the edge.
absolutely. And so when we look at, you know, patients, and I've studied so many patients in so many case studies, that what happens with these case studies is more often than not, there is something that pushes these patients over the edge, right? And in certain situations, I have a patient right now, as a matter of fact, with ALS, who lost his son very shortly before he developed ALS. Other
Wow.
patients who lost another loved one, or who have had some intense stress or intense trauma with their personal relationships or what have you, or a fractured something. And this is actually, the fracture is pretty interesting, because even in the traditional world, when they're looking at precipitating factors, that's been kind of an interesting thing, because it deals with inflammation in the body, right? Triggers of inflammation in the body. In the case of my husband, there was a fracture. There was a trauma of losing his mother, who he was very, very, very close to. There was a lot of stress dealing with just other things that were going on in life for him, relating to his profession and his businesses. And then there was the trauma of also the weight loss, where it released a lot of toxins. And so when I go back and look at all that, there were a lot of things that could have precipitated it. But in his case, there was also a genetic predisposition, because his paternal uncle also had ALS, and he just passed last year.
Oh, wow.
Yeah.
So that was probably something that made him suspicious of that earlier along, I imagine.
It did. And I think that's kind of what brought that fear into him right away. So that was an interesting part. But what's really interesting is that, just like you said, were we told that, hey, there's no treatment, there's no cure, just go home and try to live your life as best as possible? That is essentially what was told to us. And there are 2 FDA-approved drugs right now. There's one called Riluzole, and there's one called Radicava. They literally have very shoddy data. Rilozole's been around for over 20 years, and it took 20 years to get one more drug. Can you imagine? In the last 20 years, not a single, even drug. I mean, pharmaceutical companies are out there trying to come up with things, and there is a lot of research going on. But in 20 years, one drug called Radicava, which was actually fast-tracked by the FDA, it came out of Japan. And when I looked at that data, and anybody can vouch for this, the data was such that they actually it wasn't a double-blind placebo-controlled. They basically looked at it and just minimized it. And then we're trying to actually say, okay, it does have some improvement in patients who have very little loss of function thus far, who have been diagnosed, only less than 2 years from the diagnosis, so on and so forth. So it was essentially just pigeonholed into that. And it really didn't have much hope, if you will. So both of those drugs are not ones that, we've elected to stay on, because...
Well, and in a treatment vacuum like that, anything that has any plausible effect, no matter how irrelevant it is, gets undue attention. So, yeah.
Absolutely. And so, since then, nothing has been released, nothing has been approved. And so we're forced to look at what are the root causes and how do we treat the root causes. And so what we've essentially found, and we feel blessed once again that, an institution like Mayo, who have seen this over and over again, and they've seen cases from all over the world, when they thought that with his progression in mind, he had 6 to 9 months to either not being here or to have to get trached, we're at about 2 years and we're holding strong. So we feel like we're onto something, right? Everything that we've done, we feel that we have moved the needle in the right direction. And we are definitely, if nothing else, slowing the progression. And I truly believe since about February of this year, we've halted the progression, which is huge.
That's wonderful.
Yeah.
So listeners out there that may have loved ones or friends that are struggling with this, are there any general directions you would point them toward? It sounds like you are doing some patient care for this, so you may be a resource, but any other general directions you would suggest for people at this point? Or?
Absolutely. So, I would certainly say that you want to make sure, first of all, get your loved one connected to a functional medicine practitioner who can really get into the root causes. And some of the root causes that they need to look at is first and foremost gut health, right? So, because we know the gut is the other brain. So, the gut brain connection is huge. And some of the studies that have just come out talk about the different strains that we have in the gut, that an overproduction or an underproduction of certain strains have a direct link to not just ALS, but other neurodegenerative diseases such as Parkinson's, MS, Alzheimer's, dementia, and such conditions. So gut health would be huge. So to look at taking a look at all of the conditions in the gut.
Any strains top of mind as far as positive or negative ones? Or
So there's a strain that is increased, and I'll have to actually give you a link to that because it's a very long name. There's a strain that's actually protective, and we have seen that it actually increases. We can increase that strain by using NAD. Uh-huh. And that particular strain is very, very important in ALS. And I will be sure to get you the article on that, Dr. Christensen, so you can
okay,
actually
and
add a
we'll
link
put
to
that in the
the
show notes too for everyone.
Absolutely, absolutely. And that's a very, very important one. So I would definitely suggest doing a test similar to, a GI effects test or a GI map test and really looking at the gut. The other thing I would look at is infectious agents. So there has been a lot of literature on, does Lyme look a lot like ALS? So neuro-Lyme and ALS, there's a lot of similarities and commonalities between that. So definitely looking for the Lyme bacteria, definitely looking for retroviruses, and specifically you want to start with CMV, HSV, the herpes virus, and looking to see how much of the viral strain the person has. I would also look at mold, how much mold this person might have, and to try to strip down that component of it. Also test for heavy metals, because there's been a great deal of connection between mercury and neurologic symptoms in all of the neurodegenerative diseases. So looking at the heavy metals, including mercury, but not limited to it, looking at arsenic and lead and other such things. If the person has fillings, mercury fillings or amalgams, that needs to be addressed in the very initial stages if possible, but it's never too late. But it needs to be addressed very, very cautiously and carefully by a biologic dentist. I would also, on top of that, to go deeper, I would look for cavitations, which are areas, that could be developing after root canals or wisdom teeth extractions, that are areas of infection, as well as just where heavy metals might reside.
So I've seen a lot of different views, a lot of controversy back and forth about testing for toxic metals. After the research you've done, what's the methods that you're doing now for that?
I'm using urine testing.
Urine challenge testing?
We do a urine challenge test, absolutely. And, a lot of times it's very important. And I'm so glad you brought that up, because yes, you're right. There are a lot of different opinions out there. We've found in the neurodegenerative world and the ALS world that a urine challenge test is the most reliable method. And then, of course, the challenge agents are important too. So, for example, EDTA is great for lead, right? But for mercury, DMPS is better. And then you can use DMSA. So you can use either a combination or one or the other, depending on what you're suspecting and what kind of exposure you're suspecting. So, but a urine test, to me, a pre and post challenge test is very reliable from everything I've looked at and from the patients that I've treated. So that would be good. And then, of course, anything that we're testing here, we're testing it because we want to treat it and we have methods to treat it, right? So I am not a big fan of, let's just test to see, because just like you and I just talked about, finding out a root cause, if we can't change it, what good is that? We don't want to spend people's money to do that. But if we can test so that we can treat, now that makes sense, right? So testing for all of those things makes a lot of sense. Looking at toxins, and when I say toxins, I don't just mean physiologic toxins that we've already talked about. I mean emotional toxins. I mean mental toxins, spiritual toxins. So we all carry memories, right? We all carry with us traumas of whatever it may be. It may be our childhood, it may be traumas, it may be losses, maybe any of those things. And what I truly believe over the last 15, 20 years of doing, functional medicine, and then most recently over the last 2 years of seeing some people that are really, really in bad shape, I believe that emotional traumas and spiritual traumas really get stuck in our bodies in certain ways, that it truly causes what you and I call dis-ease, right? So what is disease? It's just dis-ease in our bodies, where our bodies are not able to get rid of what is fully capable of getting rid of, but it can't, because we're just in a dis-ease state. And so really looking at more of the emotional and spiritual work, I think, is very, very important. And I'm a huge believer in this, Dr. Christensen, because you can give a person a lot of medical treatments. And I think we in functional medicine are really good at that. And we really believe in getting to the root cause and treating the root cause. But you can only get a person so far unless you deal with all the emotions that are trapped in their bodies, and then create a blockage, so to speak, of releasing a lot of that physiologic disease. Tell me your thought on that. Do you feel that that's what you've seen in your patients?
In terms of being a driver for triggering chronic disease, yeah, there's such strong data on that. You've probably seen a lot of the data around the ACE scores, the Adverse Childhood Experience scores, where it's huge predictors of all types of chronic conditions, depressive risk, suicidality risk, early mortality. And in some ways, people thought that they were just predictors of substance abuse or lifestyle habits that would then in turn cause issues. But many of the follow-up studies did control. They did say, well, let's factor that part out of it. And it wasn't just that stress made people not live as well. Early traumas changed the body in some physiologic way. So for sure, I have no doubt there's a large connection that way.
Yeah, absolutely. And, so for a lot of patients, I actually refer them and make sure that they're incorporating just as much as, me working on their inflammatory agents and their toxins. I help them work on, emotional release. So meditation and mindfulness and qigong and yoga and relaxation techniques, and make sure that they're getting enough sleep, because of course, without sleep, you're not healing, right? And getting enough detoxification, getting enough sunlight, getting enough infrared, maybe sauna, light therapy. All of those are part of what we have developed as our neurodegenerative protocol and what we now call our brain and body boot camp. Because to us, and in my practice, we want to kind of take a look at all of those components and do what we need to do for the inflammation. So we do things like a lot of glutathione. We do phosphatidylcholine. We do, things that really decrease that inflammation in the body. So there's a protocol called the PK protocol. I'm sure you're familiar with it. It's a protocol that was developed for neurodegenerative conditions, and it's a fantastic protocol because it incorporates things like butyrate, phosphatidylcholine, glutathione, leucovorin, and methylcobalamin to really address the toxins in the cells and allow the cells to really regenerate themselves and to release all the toxins and inflammation. So we incorporate that for our patients. In fact, this is a protocol that I actually flew my husband across the country to do in the initial stages, and it did help him. And so we've incorporated that into our protocol. We look at the gut-brain connection, treating the autoimmune components, detoxifying the body in many different ways, getting rid of heavy metals, and really rebuilding the body, because I believe very strongly that the body is very, very capable of healing itself if you give it the right ingredients. And this is very well documented even in ALS, because most people in the field of ALS will never use ALS and reversal in the same sentence, right? Because ALS across the world is just looked at as being an incurable death sentence. And we have, and this is the best news I can give you today, we have been able to document, and it's not me doing the documentation, but out of Duke University, there's a doctor named Dr. Richard Bedlack, who has made his life's mission at Duke University to identify and make sure that it was the correct diagnosis, but to identify and document ALS reversals. And he has been able to document over 40 ALS reversals.
Really?
Isn't that crazy?
So, yeah, not just slowed progression, but they've gone back to, they've lost, this generation's gone away.
Yes. So they have actually reversed the function that they've lost. I personally have done Zoom calls with two of those reversals who were completely paralyzed.
Wow.
I'm talking completely paralyzed, neck down. We're still able to speak. One was able to speak and eat. The other one was able to speak, but with slurred speech. But so one of them is 70 years old now,
Wow.
and she is out there chopping wood. She has this, yes. Can you imagine? She was completely paralyzed, and now she's out chopping wood, living the healthiest life possible. And I've looked at least, I've looked at their stories. I've looked at all of these patients' journeys. And one thing, they've all done different things, right? So some have done detoxification, and some have done ozone, and some have done hyperbaric, some have done, most of them have done nutritional supplementation, of course. Most of them have cleaned out their eating and resting and stress management and all of that. But one thing that they all have in common, and that's what I was looking for, is the common straw, right?
Yeah.
What did they do that they all have in common? Everybody that I've spoken to. And that is the mind-body healing component. And it's amazing because it's the positivity, the belief. And that's why I never, ever liked to have ALS patients or any other neurodegenerative patients to feel like this is hopeless. There is no hope. I can never get better. I can never, ever regain my function. This is my life. This is a life, a death sentence. All of those beliefs in themselves, I believe, take you down much faster and enhance your progression because you've claimed it. You've owned this, not just the diagnosis, but the prognosis. And I always say to my patients, you may have the diagnosis, but don't own the prognosis because your body and your mind is stronger than you will ever, ever imagine. And you too can do anything. Anything is possible. We all believe in miracles, but it doesn't even have to be a miracle, quote unquote, if you don't believe in it. But we all believe that our human body is such a strong machine, so well made, by the grace of God, that it can do just about anything that it puts its mind to.
That's really incredible.
Yeah.
Super inspirational.
Yeah. So that's been amazing. And so for us, we've done a lot of mind-body work, not just for IS, but our entire family. And I make it a point to make sure my patients are doing a lot of the mind-body work. So we're actually co-hosting a conference in October in Salt Lake City where we've invited 10 of the reversals to kind of speak. Yeah. Yeah. And the message that we want to give to the world, Dr. Christensen, is this is not a hopeless condition. There are things we can do to A, slow it down, to B, perhaps even halt it, and to C, perhaps even reverse it. But it's not easy. None of this is easy. But is it possible? Yes, it is possible. And so the take-home message being that there's never going to be one single drug cure for a condition like ALS or Parkinson's or MS or Alzheimer's or dementia, in my opinion. And I can speak definitely as an expert on ALS that there will not be one drug that'll just completely stop it, halt it, reverse it, all of the above. I truly believe it's going to be a cocktail of therapies that address a lot of the root causes, as well as regenerative medicine will be a big component of it, because once you lose a lot of the motor neurons, and we don't know if the motor neurons are dormant or are they atretic or gone for good. But we'd like to hope that they're not gone for good and they can be regenerated.
So that's really incredible. So
yeah,
awesome stuff. So there's an event you've got coming up, and there are reversals happening. So
yes,
it's phenomenal news.
Yes, it's very encouraging and we'd like to get that message out to the entire, world out there to know that it doesn't have to be a death sentence, but if you own the prognosis, it will be. It will be, because, the hopelessness then creates fear, and fear creates a rapidity of progression, in my opinion. But if you don't have hopelessness, if you actually work from the angle of hope and faith and, being proactive and doing the right things for your body and strengthening your body from a cellular level, then we can try, and then the rest of it is up to God, right? But as humans, we can do everything that we can do, and then we leave it to the one above.
So, Dr. Shell, let's have you back. We've got a mutual friend that may have an interest in participating too, but let's have you back on a future episode and let's talk through a bit more, because you also mentioned there's so much we can cover about how this is ALS, but we've got other neurodegenerative diseases that have a similar theme in that there's really not a lot of hope given, but there are things that can be done. So let's talk more about that in a future episode and get more resources for people that way too.
For sure. I would love it. I would love to, help in any way possible to get the message out about neurodegenerative diseases and ALS and, anything that I can do to help patients regain some of that hope and give them the quality of life that they're looking for. It's always it's an honor. It's an honor, and it's become my new mission.
I've known you for some time from before this happened, and I've always admired you and thought you were someone who was passionate, doing a great job, and really heart-centered. And
thank you.
Yeah, this is a big new chapter. So kudos to what you're doing, the difference you're making right now, and the hope that you're sharing.
Thank you so much, Dr. Christensen. And the same back at you. I mean, the things that you have done over the years that I've known you. I mean, I'm just in awe. So, you've made such a huge difference to hundreds of thousands of people out there. And, I give your example all the time to my patients, especially when it comes to thyroid disease and autoimmune disease. I mean, you're just the person to go to. So right back at you. Right back at you.
Well, awesome. Really appreciate your time, Dr. Shell. And thank you so much.
Thank you. Thank you for allowing me to be on the podcast and share my mission.
And those who joined us, thanks for being with us too. We'll see you again real soon. And take great care of yourself. Hey, Dr. Christensen here. Thanks so much for joining me for another episode. Is there a topic you'd like me to cover? I'd love to hear from you. Just go to Dr. Alan Christensen on Facebook or Instagram, write your question, and use the hashtag #MedicalMyths. Did you find this show helpful? If so, please take a minute and leave us a rating on iTunes so that others can know. Thanks much, and I'll be back with you real soon. Bye-bye.